old, 29, and today I'm at Haley Medical Aesthetic. Okay, actually I have this skin concern which is sagging skin, and also due to gravity, right, and collagen loss, my face is getting like larger at this portion. So I want to firm up my skin, and today I'm here to meet Dr. Terence Tan to try out Potenza RF microneedling so that it will help boost collagen and also elastin level of my skin. So follow me to check it out. Okay, hi Dr. Terence Tan. So I actually have a skin concern because I'm aging as well, right? So we lose collagen every day. So I hope to find something that can help to lift up my skin.
Okay.
Yeah.
All right, I understand. So obviously when it comes to lifting of the skin, there are quite a few treatments that are available in most aesthetic clinics. There's our therapy. If it's machine based, it can be our therapy. It can be Potenza, which is what we are most likely going to do today, which is microneedling RF, HIFU, and other machines. Yeah, so injectables, we can help with skin tightening. But I think for you, my main recommendation would be Potenza. Okay. So Potenza is microneedling radio frequency.
This is something new.
Okay. Do you know what that means?
Maybe you can share more with me.
Okay, all right. So radio frequency is a form of energy. Okay, so for us to stimulate collagen, that we must have some form of energy to force the skin to produce more collagen. It can be done through ultrasound, but very frequently we use radio frequency. So specific to Potenza, it uses needles, micro needles, really small needles, which pierce through the skin before delivering the radio frequency energy to stimulate collagen for a few purposes. Okay, so number one, yes, you're right. As you have said, you want to stimulate collagen for skin tightening. So that's very common amongst our Asian patients complaining of saggy cheeks. For Caucasians and people slightly older than you, they're concerned with wrinkles, with eye bags, and it's also effective for that. Yeah. It also has other benefits, which is not so much aging, but people with acne scars, people with larger pores, or people just really want a smoother and better complexion. It also works.
Wow.
Lastly, some people have melasma. So melasma is a form of pigmentation which is very troublesome, found mainly in females. And in this case, the melasma is pigmentation over the cheeks, which span a really big area. In certain cases, we can also use Potenza to treat melasma. Yeah, so there are many different benefits to using Potenza. But in this case, for you anyway, I think there are a few things that we would concentrate on. So number one is of course your main concern, which is what you said you are bothered about. So saggy cheeks, sagginess of certain areas. But at the same time, I think we can also help a little bit with the areas and the wrinkles around the eyes.
Yeah, I believe I have some wrinkle around the eyes and the forehead as well.
Yes, and also maybe eye bags or whatever else that we can address. I also see some acne scars.
Yes.
Yeah, and I think that's why I choose to do Potenza for you, because it seems to fit really well. So on the anti-aging aspect, we will treat your wrinkles, your sagginess, and then for non-anti-aging, you can help in terms of your acne scars. And so I think that is a good fit for you. Yes, I think more important than having a fixed time whereby people have to come back, it's really a matter of what our expectations are and what we're actually treating. So for younger people who just have acne scars, you really don't need much maintenance at all. But for most of us, whereby we want to do it for anti-aging, after doing that, I think maybe just one treatment every half a year will be a good idea. But there's really no hard and fast rule. It really depends on what's your budget, how much you like treatment, how much time you have, how much, what's your expectations versus how much sagginess do you have. So, but most people, I think, after doing a consecutive 2 to 3 to 4 treatments, once every half a year, would be a very good idea.
Okay.
It's not very long and it's very, very thin, so don't worry, it's not very painful.
Okay.
But I think as with most treatments, there will be some pain involved, and therefore it's good to put numbing cream before. During the treatment, there are many things that we can do to make the treatment more comfortable. So for example, we can choose how deep we want to apply the needles. We can also tweak the energy level in order to have the best combination of comfort and effectiveness.
Okay.
Yeah, so I won't worry about that too much. During the treatment, we also have a blower that we sometimes use to cool the surface of the skin while the treatment is being concentrated deep underneath that skin.
Okay.
So there's some of those things that we can do. But in general, it's a highly tolerable treatment. Yeah. So I think that when people think a little about needles and stuff like that, they really get really scared.
Yeah.
Yeah, but these needles are really small. And I myself was surprised at how tolerable it was and how little downtime that was. So this is actually a good kind of treatment for most people.
That sounds good to me.
Okay,
Yeah.
all right. So yeah, if you have no further questions, I think we will just carry on. We will wash your face, put some numbing cream, and then probably we'll start in about 15 minutes time.
Okay.
Okay, here you are. Alright, so it's just a little bit red, yeah? Yeah, and a lot of the redness will actually go away quite fast. Yeah, so with a little makeup, you can actually go back to work tomorrow. Yeah, and it looks quite even and it's quite nice. Yeah, so we repeat in 1 month's time, okay?
Okay, so I've just done with my Potenza RF micro needling. So as you can see, my skin is a little bit red. So it's fine because it will be gone in like a few hours to maybe a day, and I can start putting on my makeup. So during the treatment, what I felt is that the needle is like creating punctures in my face. So immediate effect is like the skin is stimulating. So I did feel something. So I'll be back in a month to do my second treatment.